Good afternoon, and welcome to our series of webinars focused on bringing you information about COVID-19, infection control, and other nursing home related topics. The information in these weekly webinars is geared toward long-term care and skilled nursing facilities, but we encourage everyone who's interested to attend. My name is Kathy Caudill. I'm a communications specialist with Quality Insights. Today's webinar is Pennsylvania Project Firstline, Great Escape from Infections. Everyone has entered the meeting on mute, but we will have a Q&A following the presentation. If you have questions or comments, please submit them using either the chat or the Q&A tool in your Zoom menu. We invite you to join us every Wednesday for more of our weekly webinars. Due to Christmas and the New Year's holidays falling on Wednesdays this year, we will not be having webinars for the next 2 weeks. So our next webinar will be Wednesday, January 8th. And that webinar will be a live Q&A on infection control and immunization efforts. If you're interested in submitting a question for that webinar, I will put a link in the chat shortly where you can do so. And now I would like to introduce our speaker today, Merewyn Sheeran. Mary is an infection preventionist with the Bureau of Epidemiology at the Pennsylvania Department of Health. She is part of the Division of Healthcare Associated Infection Prevention and a subject matter expert for Pennsylvania Project Firstline. Pennsylvania Project Firstline, developed in partnership with the CDC, is an innovative project designed to promote foundational knowledge of infection prevention and control for all types of frontline healthcare workers. Quality Insights will be collaborating with Pennsylvania Project Firstline to help facilities run escape rooms to bring this hands-on, engaging educational tool to nursing homes, empowering healthcare teams to strengthen their infection prevention practices. Mary, thank you for joining us today.
Thank you so much for the opportunity to speak on the escape room. It's one of my very favorite educations. Let me just turn off my camera here. Okay, video, goodbye. Okay, so yeah, let me just get started because I have been doing escape rooms for Project Firstline, PA Project Firstline for a good year and a half now since we rolled out the education. So we do have some objectives for this education that you will be able to describe 3 of the challenges faced when providing infection prevention and control education for various types of frontline healthcare workers. Apply 2 of the lessons learned in this presentation to your own settings, and then identify 3 potential ways escape rooms in general can improve learning compared to traditional education delivery methods. So I am going to speak about the Project Firstline escape room, which is an infection prevention based escape room. But the escape room format can be used to teach so many different things in a long-term care facility. So I always like to say, we offer direct training for our Pennsylvania facilities and also a train the trainer option. So we, go through how to run your own escape room, provide you with the materials to set up your own kit. Or we don't provide them, but we let you know what you need to get to set up your own kit. But why do we even want to think about this escape room? Some of the key words today are non-traditional education, evidence-based education, and these are all things that we accomplish with the escape room. So why are we changing this delivery? We do know it's an ongoing infection prevention education. That's one of our highest priorities of an infection prevention and control program. But we have challenges disseminating and implementing education. So we know that implementing is, such a major challenge. We are addressing, we're trying to reach many types of frontline healthcare workers, some like environmental services, dietary activities, social work. I mean, we're all part of that frontline healthcare team. So the education should be able to reach all of those audiences. We know that our target audience, they are suffering from information overload. Regulations are constantly changing, not just in infection prevention. Actually, we've kind of leveled up a little bit. But there's also that physical and mental fatigue. And that requires us to find a different approach toward education. Okay, so we know that the disseminating of the infection prevention education is a challenge. That time that we have, I used to give 1 hour in services as an infection preventionist, like all the time. We don't have that. I went to putting things on the back of bathroom doors and so forth. We need something, though, that really piques that interest of the healthcare workers, gets their attention. And we need to do it in a very succinct and powerful way. So that's why we need these innovative approaches. So there are different types of adult learning methods, and one is problem-based learning. You're probably familiar with that as in terms of a case study. We have flipped learning, where you learn content online or through book reading, and then when you have that valuable for face-to-face education, instead of presenting more slides, you have people actually apply what they've learned, and that happens in high school and middle school classrooms. I saw that with my own children, that how education has just completely changed. So they spend that valuable time actually building on their knowledge and doing things hands-on. Then we have gamification. And that's where we consolidate the knowledge and acquire new skills. And that is part of an escape room. And we use all of these learning methods in the escape room. So we talk about active learning in terms of the escape room, because that's what it's all about. So active learning, tasks include group work and hands-on challenges. That's exactly what we do. So we design easy escape room tasks centered around curriculum learning objectives. And the benefits are that collaboration, our teams learn to communicate with each other, especially if you have healthcare workers from different disciplines. We take them out of their silos and they're all working together for a common cause. It teaches them how to prioritize. What are the facts that I need to know? We really keep it to basics. The active learning leads to increased confidence, that enhanced knowledge, and critical thinking. So that is so important. So how do I solve this problem? Everything is not like what it is in the textbook. It changes based on your setting, and all of these things create that enthusiasm for learning. And I have to say, when I do an escape room, and it's our most asked for education from Project Firstline, is that I have people coming in and their heads are hanging low. I don't have time for this, da da da. And then they come out and they're smiling and they're laughing with each other. It's a wonderful experience. And I've done so many and I'm never bored presenting the same escape room over and over, because it is always different based on the team. Um, Team-based learning is wonderful. It gets those different groups of healthcare workers together, dealing with some aspect of clinical care. The current escape room that we're running right now is a respiratory escape room. So it's timely because of the time of year, but we know respiratory infections go around all year long. So it never is out of style. Team-based learning, we engage all members of the disciplines and we use that teamwork. Teamwork is, I always say, because we make it as a competition. So the more a team works as a team, they get through the escape room faster, and they also do take in the education the points that you're trying to get across. So so integral to this whole process. So the escape room concept. The escape room format provides that supportive, safe, and dynamically engaging environment for developing attendees' knowledge related to infection prevention and control practices. Participants will learn how to use the escape room format in their facility to enhance and improve infection prevention foundational practical knowledge. So that is what I am doing when I do the trainer, is helping them use that format to deliver education. So what are the benefits of the escape room? I could just talk to you an hour at least about the benefits, but it engages learners in the virtual and physical environment. It can be adapted for any setting. And you can make it as elaborate or simple as your facility allows. It can be used to evaluate education that you've already provided, or you can also use it, let me go back, or you can also use it to get a baseline, see where, which groups. I've had teams go through and the IP says, wow, our EVS, I need to do more education with them. They were struggling with some of the concepts. So you can identify gaps, or you can evaluate how well your program went over. Okay, so it's a live action team-based game where players discover clues, solve puzzles, and accomplish tasks in one or more rooms to accomplish a specific goal. That is, and that's what we do with the escape room. We do keep it to one room, but I have done it on like a wing, a closed wing of a long-term care facility, and I have each station in a separate room. So really, sky's the limit. This has been, escape rooms were published about for healthcare education during the pandemic. And that's when the Project Firstline state groups started developing the ideas based on the Central Texas Veterans Healthcare System escape room that was published in the Journal of Infection Prevention and Control. They were using it as a scenario. There's pandemic novel influenza, and they had all these different steps, but I don't want to spend too long speaking about this. I could spend like an hour on this presentation. I'm going to give you, we're going to get more into how do we go about planning an escape room using that Project Firstline escape room as a backup, okay, as our example. So for planning, you always want to have a goal. What are we trying to get across? The focus is on healthcare worker judgments using a problem-solving process that is goal-oriented and follows best practice. So you're going to start with, what are my learning objectives that I want to get across? What supplies am I going to need? This design can vary. It can be a very limited cost. And you want to make it so it's easy to replicate and modify. So, and all of those things are parts of the Project Firstline escape room. We want to have that teamwork. It's a fun way. And this is some of our Project Firstline Pennsylvania Project Firstline team. It's a fun way for all healthcare worker disciplines to work together to escape before time runs out. You want to have rules. So these are the rules for the Project Firstline escape room. You want to establish how many players. So originally the escape room was for 6 players. We actually found in doing this 4 to 5 keeps everybody engaged. You have more than 5 people are standing in the background not doing anything. We have a time limit of 30 minutes. So that's much more doable within a healthcare environment because people cannot leave their units for a very long time. If you have an interdisciplinary team, you're only maybe losing one nursing assistant, one LPN, someone from activities, someone from EVS. So you're not losing your whole team at one time. So the original escape room had deductions for hints. I never deduct for hints. I give plenty of hints. And you want to determine where you're going to hide clues because this is a game. It's fun. So we tell teams they have 30 minutes to complete the program, the activity. And I don't do any penalties or anything like that. But these are parts of the original escape room. Okay, you want to have your list of supplies. This is from the Project Firstline escape room manual. The original escape room was based on a COVID. It was developed during the COVID Delta variant. So we have changed it and modified it so that it's for influenza and other respiratory viruses. So all respiratory viruses. But it's nice to have your supplies so you make sure you have everything together. And you want to have a fun, engaging story. So I actually have a little cutout of Captain Germbegon and that little dude down there, Clutterbug. And we just say, we need your help. Captain Germbegon is fighting the never-ending battle with seasonal flu and other respiratory viruses, but he needs your help, the frontline healthcare workers, because they are the true heroes in the story. Clutterbug has put clues all over the room, and he needs you to help go through the stations so he can identify the steps to take to keep influenza and other respiratory viruses from spreading to the healthcare workers and residents, visitors of whatever facility you're teaching in. So, and I do want to just give a shout out to the New Jersey, New York, Wyoming, and Utah Project Firstline teams. They developed the 4 stations that we now know as the Project Firstline original escape room, and this one is respiratory illnesses. You always want to have a kind of a fun escape room entrance just so people know where they're going. I teach a lot in basements, so we just put signs all over the door. I actually didn't make these. One of our very creative IPs at a facility where I trained made all of these really nice signs. She made up this whole board with her lights, which came in handy because we lost power. It was during a flood and we lost power in the room, but we lost our lights, but we still could do the escape room because I used lots of simulated germ products. So things glow in the escape room, just made it more spooky and fun. So the escape room, the logistics, you just need the room to set up 4 stations. So if we go from left and around, you start right in the front there. That's the sign in. And then we had station 1 was the table to your left. The table in the back is I think that's station 4. I might have just done that backwards. Going from the right, I am so directionally challenged. Going from the right is station 1, station 2, then in the back is station 3, and then station 4 sign out. So it does not take a lot of room, and a lot of facilities don't have that room to dedicate to education. We have even done the escape room in a supply closet. We don't prefer that, but it can be done. Okay, so station 1 is our hand hygiene station, and the learning objectives there, just checking my time, learning objectives are describing when to clean hands for soap and water versus alcohol-based hand rub. We added a scenario to determine which type of hand hygiene is appropriate if both alcohol-based hand rub or sanitizer, I should say, and soap and water are available. We also have direct observation, and this is nice for facilities because if they have competencies to get done, we can have everybody in the group demonstrate, say, using alcohol-based hand sanitizer. And while we do not sign off on the competencies, the IP or the educator can do that. So we can help you meet some of your training objectives for the year. And they also have they complete a puzzle, which is that involves teamwork. They do read out some of the clues. We have worked on making our escape rooms moving forward, and I've given the modifications to Jen with Quality Insights so that we are using more pictures and writing, so it's not so reading heavy. So adding a scenario has really made it much more interesting. I love doing scenarios. So I just have some pictures in the next couple slides of different setups. So this was one of our hand hygiene stations. This was in an activities room. There we use every station has a metal box. That's where we hide the clues. And the object is to read through the different clues to figure out the code to open the box, because in there is one of 4 final puzzle pieces, or there is a challenge. So in this case, in this station, it's a puzzle that they put together, and then they have to read through the steps of proper hand hygiene. So these are the clues. Alcohol-based hand rub there, which I normally would not have next to soap and water, but for this station, we do that. And we use our Project Firstline posters that are on the PA Project Firstline webpage. We use the Project Firstline and CDC infographics and printables. So most of these resources are at no cost. So this was at a personal care home where I ran this. This was actually in a resident room, and it was perfect because the soap dispenser had no soap, and it was a hand dryer. So we definitely were not going to use that. So we talked about why alcohol-based hand sanitizer with my scenario was a better option. So I often just go on the fly. I use my simulated germ product to show that sinks, even though we're cleaning our hands in them, they are filthy. So that's why we want to be careful about what we touch after our hands are clean and in the process of cleaning. This was in an acute care facility, and this was their training room. So you can see that this adapts to so many different settings. And then this was done in just like a conference room at the Department of Health. So as I was saying, you can set this up anywhere. That's my favorite T-Rex poster. It's actually not my favorite. I like the corgis that you'll see. This is one of the Project Firstline infographics. And we hide one of the clues in that actually with invisible ink, but you didn't hear me say that. So, okay, station 2, source control for respiratory infections. Our learning objectives, as you can see, are to describe how respiratory droplets spread, the benefits of proper mask positioning, and explain the purpose of source control. So here is an example of one of our stations. As you see, the locked box again. We have a mirror there because at one point, and you'll see it, we use a backwards upside down puzzle. I'll get into why we changed that. Here is in that personal care room. And you can just see like here I had no room, so I put all the boxes together in one place. This was employees from EVS putting together the upside down backwards puzzle, but people were taking so long working on the puzzle, they missed the whole concept. So we used our corgi poster, which is my absolutely favorite mask positioning poster. And we're in the process of taking off the COVID specific information on there. But we took this poster and we turned it into a puzzle. And that has now replaced the upside down backwards puzzle. This is another CDC infographic on actions to prevent respiratory infections, all available for free on the CDC Project Firstline website. So we want this to be cost effective and easy for facilities to be able to implement. So the station 3, one of my favorites is personal protective equipment. We review the step-by-step directions for donning and doffing using the CDC sequence, or if a facility has like printed cards, we'll go by their policies, and performing donning, doffing. We also come into the discussion cloth versus disposable gown. What are the acceptable ways to doff those? And we use simulated germ products to make the donning and doffing fun and interactive. So we're partnering with Quality Insights to make this more available, but we have partnered with, the first partner was the AMI RISE team out in the west and central part of the state, and actually in the Northeast. When we were a very tiny team, we really needed the help of others to deploy this education. So this was their setup, which was they used some of the education, our slides from Project Firstline, in addition to the infographics and so forth. But we've also partnered with the Penn Temple RISE team in the Southeast, and I did a train the trainer with them so that they go out and offer that. And also Philadelphia Department of Health, they have their Philadelphia Project Firstline offers the Project Firstline escape room. We want this accessible to all healthcare workers. That is our goal. So our station is really simple. The locked box again, and same thing. But this is, people have so much fun. So one person dons, the rest of the team helps them, reads them through the sequence. Then they have to, I have a germ ball that I put simulated germ product on. They roll it around their hands and up and down the outside of their PPE, and they see why they take off their PPE in a certain order. It's really effective for helping them realize, no, you don't want to contaminate yourself as you're removing your PPE. And we talk about hand hygiene moments if you touch something on the outside. Station 4, I should say, it's cleaning and disinfection. I love cleaning and disinfection. And we identify high touch surfaces, reading a disinfectant label, and understanding contact time. I will say understanding contact time is the learning gap that I see the most when I do these escape rooms. And again, we use simulated germ product to enhance the education. So we have disinfectants and cleaners, a mix of them. The facility, we usually ask to provide the wipe or cleaner that they use the most commonly, so we can really reinforce the contact time for those things. We have the keyboard as a high touch area, and we have that lockbox again. Personal care home setup. So and this was later. So I have my tissue. If I don't know if you can see that above the keyboard, that has a sneeze all over it. We've got a mouse pad. We have a, it doesn't look like it's a contaminated cup. When you shine the light on it, it is glowing, and showing how germs spread from the keyboard to the cup to the mouse. I have an iPhone usually there. So really to, like, get across, don't eat at the nurse's station or while you're doing your charting and things like that. So, and again, there's one of the infographics from Project Firstline on dry surfaces. That's one of our reservoirs. And we use the how to read a disinfectant label, which is available. I want to say that these infographics are available in Spanish and English. I have found some of them in Haitian Creole as well. Because our other Project Firstline state groups have, Massachusetts has made available the Haitian Creole. So it's wonderful to be able to offer education in a healthcare worker's native language as well. These are our healthcare workers looking at the contact times. And they have to identify one, there's a clue hidden in one, which is this. They have a crossword puzzle of high touch areas. And then the disinfectant label, I have a magnifying glass that I always put over contact time, because if they can't recite it, I have them read the definition about the wet time element of it. And then we have our, at the back table, we have, what you made it, and these are your main topics. I will go over, if there is enough time, the main points that were, that we learned through this. And also, I've had facilities set up this wall where they take pictures of the teams at the ends. We also have, we've provided for the escape rooms that we run, a Pennsylvania Department of Health Certificate of Achievement. We write the escape time, or we just write the date, depending on what the facility wants. This is old data, so this just like triple that. We've had so much participation in this. So I will say, I'm thinking of the numbers now. We probably have, we've done this in all settings. We've done this in dialysis centers. We've done this in long-term care, personal care homes, outpatient ORs, and of course acute care as well. So wide range of healthcare worker types. So that was the breakdown last January. It's been another year. So we have to rework these numbers again. And we just lost our data person, or I would have updated these numbers for you. But we have someone else stepping into that role, not me, because I don't do data. I don't like it. So I do like it, but I just don't like playing with numbers. And then this is going to be included in the chat, but this is our flyer to sign up for an escape room in PA, well, in especially like outside of Philadelphia. If you accidentally sign up, you can, there's it can be, I can get it to the right person. I always do that. And then I should say, are there any questions? So I will stop sharing at this point.
All right.
And I kind of kept on time there. That's good for me, because I'm a talker.
Right, 30.
So,
So, all right, we'll start the Q&A here in a minute.
okay.
So if anyone has a question or comment, please submit it using the chat or the Q&A tool. You can also raise your hand if you would like to ask your question out loud. And while we're waiting, I'd again like to invite everyone again to our January 8th webinar, which will be a live Q&A on infection control and immunization. And we're inviting people to submit their questions in advance for that. So if you have a question, I'll put in the chat again a link to the form where you can send your question in. And we will not be having webinars for the next 2 weeks, since the next 2 Wednesdays will be Christmas and the New Year's holiday. So our next webinar is January 8th. You can find the links to our webinars in the newsletter we send out every Friday called the Last Minute Lowdown. And if you'd like to receive that newsletter, but you don't think you're on the mailing list, you can email me at ccaudill@qualityinsights.org. And I'll get you on that list. And I will put my email in the chat here in a moment, along with that form for submitting your questions for that next webinar. And I don't see any questions so far in the chat or the Q&A, and I don't think I see any hands raised. So before we begin to close out, I'd like to ask any of our panelists who are here if they'd like to pop in and say anything. And if not, Mary, do you have any closing items?
I do want to say, because I am PA Project Firstline, I have to keep the escape room like based on the CDC escape room. But if you use this in your own facility, you can add stations. You don't have to do all 4 stations. I always discuss that when I do the train the trainer, that say you're teaching 11 to 7 and you're doing the escape room with them, because I used to work 3 to 11, 11 to 7 as a charge nurse. We didn't get any of the education. It was all on day shift. So, so you can do like maybe 1 station a month, and just break it up. I have to do it as a product, but anybody else who is not Project Firstline, you can do it any way you want. So, and you can add stations. If I were in my own facility, I'd add a vaccine station too. So I think that would lend itself. And we are developing other escape rooms. We're using the same format. So once you buy those boxes, that's really the biggest cost, and that's not much. But we're doing a diarrhea escape room, which is going to be so much fun. And looking at future, we're also pretty near the end of our development. We have an EMS escape room as well. So it is such a fun way to teach. I love it. And Jen and Deb have both gone through escape rooms with me. So
Yeah, it's a really wonderful program. So thank you so much for presenting on that today. And I'd like to thank all of you guys for joining us today to learn about the Infection Control Escape Room program and how it serves as an alternative for education. A lot of times we have sort of the same sort of, you know, thing that we do at our facility. So this is just something fun and interactive to do. So if anyone has any questions, after the webinar is over or would like to learn more about bringing the program to your facility, please don't hesitate to reach out. Mary gave you her contact information to sign up through PA Project Firstline. But, if there's anyone in the Philadelphia area, in the West Virginia, please reach out and, we can get something going. So thank you all for joining us today, and I hope you all have a wonderful rest of your day.
yeah, thank you.
Thank you, Jen. All right, well, I don't think we got any questions, so I think I can close us out. I also wanted to mention that I put more links in the chat because Mary gave me some great resources. There's some for Pennsylvania Project Firstline. I put a link to that. And then I also put in the link to download today's presentation slides. And I will also be emailing these resources and a link to the recording later this week to everyone who registered for today's webinar. So if you didn't get a chance to copy any of this down, just keep an eye on your inbox. Thursday or Friday, I'll have that out to everybody. And I think I can go ahead and wrap us up. Before we sign off, I'd like to ask everyone here to please answer a short evaluation of today's webinar. It's anonymous and it will show as a pop-up as soon as the webinar ends. So if you have a couple minutes to fill that out, we would appreciate it. Mary, I'd like to thank you for joining us today and for this really great presentation. And I'd like to thank our attendees for joining today, and we hope to see you again soon after the holidays. Have a happy New Year's and a Merry Christmas.